something good is going to happen in the country in the name of Heal by India, and you all have to play a greater role. Now we just have two quick presentations on smart technologies, and short presentations by two tech companies who have built some smart health technology solutions. So we would like to invite Tricog. They have some instant ECG solutions. So the whole concept and objective of this exercise of the last 2 days is to make the practitioners and users know more about smart technologies, and we are just trying to create some space for the tech companies to showcase and demonstrate their solutions. Over to you, Tricog. Yeah.
Hello delegates, thank you so much for this opportunity. My name is Davidson, and I'm the zonal manager from Tricog, and actually we are so privileged to be here in God's own country, and I would like to present Tricog, what's the solution that we solve, and and also how we make a tech-savvy solution in saving patients' life with cardiac ailment. So I would also like to tell you that Tricog is is one of the world's leading predictive analytics company related to cardiac diagnosis. And let me just make my presentation. Thank you. So Tricog, what we solve. And as the data suggests, and the clinical presentation is very clear, very obvious, that almost 28.1% of the patients, they die out of cardiovascular diseases in our country. This was the data in 2016. Right now, it should be phenomenally high. And what happens is the average time for treatment of a cardiac ailment, which is detrimental or with high mortality rates, is 4 to 6 hours, whereas the golden window period is only 2 to 3 hours. If in 2 to 3 hours a patient with a cardiac ailment or a heart attack, what we call in layman's language, reaches a cath lab or a hospital, tertiary care hospital, where you can provide PCI, which is angioplasty, then he can be saved. But if it is 4 to 6 hours or more, there are 80% chances that the patient may succumb to his ailment. And a critical heart condition can be detected through a quick screening test we can call, or an electrocardiogram that we call here, and EKG that we call in US. Patients with a MI, which is medically called myocardial infarction or heart attack, they reached a facility with a solution or treatment at about 4 to 5 hours, which says almost the data says 80% of the patients, they reach more than 6 hours to a cath lab. And the problem here is that you have to get the patient with a heart attack within 3 hours to the cath lab. And why this happens is also why we started this company. The director of this company is intervention cardiologist himself. So he's Mr. Charit Bograj. I think he's a renowned intervention cardiologist in Bangalore. And when he was a junior doctor in Wakad Hospital, it was almost about 7 years back or 8 years back, that is when he got a patient who walked into him with a acute myocardial infarction, and that patient had this kind of a condition. He realized the symptoms by around 8 o'clock, but he went to a family physician. Usually, even if I have a chest pain or something, I'll go to a family physician first because I don't know. And what happened was the family physician, he had no idea. So he said, maybe you'll have to take ranitidine because it may be because of acidity. So then he gave ranitidine, the patient went back, and still the pain increased, and palpitation, started feeling palpitation. So his wife said, why don't we go to a nursing home? They went to a nursing home where there was supposed to be a cardiac physician, but then he was not available at 8:30 in the night. So actually he then went to a duty doctor who was there present, and he said, why don't you take alprazolam, because I think it's because of anxiety. Then he took alprazolam, but he couldn't sleep. And ultimately, his wife said, come what may, we are going to a big hospital. Then that's how they landed up in Wakad Hospital, which is a tertiary care hospital. And, the doctor did in fact, Dr. Charit Bograj, he did a, ECG and found that there was a ST elevation, which is a symptom of, heart attack. And he asked him, why did it take so long for you to reach here? Then, like he said, this is what I went through. So this is what is happening. The clinical data also points to the same. It almost takes about 8 hours for a patient to reach a cardiac center to treat a heart attack. And we are here to solve this. And like we have the founder and the CEO, Dr. Charit Bograj. We have Dr. Zainul Charbiwala. He is our like CTO, or like he's also the technical director. He was working with Yahoo. And then we have Udain Dasgupta, who is like AI innovator. He was working as a professor in Boston University. And then we have Abhinav Guja, who was also into Google. Now, what is Insta ECG? I'll just wrap it up very soon. I think people are getting busy. So then, this is a cloud-based, solution. You first, we have a few steps. First, a ECG is taken in an ECG machine, and then, it is actually converted into a digital data, having something called as communicator, which has a SIM card and uses the 4G or 3G network, converts the electrical data into digital data, uploads it to the cloud, and we have a AI algorithm in the cloud which interprets the condition depending upon the waveforms of the ECG, whether it is critical, whether it is abnormal or normal. And then this data is sent to a team of doctors. We have about 35 to 40 qualified doctors, which includes intervention cardiologists as well as PGDCC doctors who are experts in interpreting ECG. And why this? Because we can't totally trust on AI for everything. I mean, and medical field, especially cardiology and all the medical field, I guess, has some expansions, a lot of which. So we can't just totally go by the AI knowledge. We also need a human interpretation, a factor that also includes all the exceptions and then gives a right diagnosis. So that is what happens. These doctors, they revalidate and re-verify and then authenticate and send it to the, the clinic from where the ECG was taken within 10 minutes. So this is, the turnaround time we have, 10 to 15 minutes. For 10 minutes for a critical, patient who's having a critical condition that has to be treated immediately, and, 15 minutes for those who have a normal ECG or abnormal ECG. And, that is how we save lives. Our core vision and our core, commitment to the society and to the healthcare industry is to save lives. Because we have the expertise, we have the infrastructure, like a cath lab facility where you can do an angioplasty, you open up clogged arteries in the heart, but then, to take the patient over there. I'll also try to be, I think some doctors are here as well. So, what happens right now, what's happening and what are we solving is that if, a patient has a heart attack, he goes after 8 hours to a cardiac center or a cath lab center. What we do, we take a ECG, we actually see there's a symptom of a heart attack, and then we go for the next step, that is, an echocardiogram, wherein we can see the, live image of the heart, and we see whether there's any, motion deformity or something of the heartbeat. And then what we said, if that's also positive, then we take him for an angiogram. Angiogram is a study wherein you see the arteries supplying blood to the heart muscles and whether there's any block or not. If that is also positive, and then we take the patient to a, a PCI or percutaneous coronary intervention or an angioplasty. So that's what happens. Okay, now the flip side of this is that most of the studies are anatomical studies. That is, you only see the artery with a blocked, a thing. You don't see the tissue where this blood is being blocked. So we are there. So if a patient comes after 8 hours, we put a stent and he spends about 1.5 lakhs or 3 lakh, he goes back. It is not that already the tissue, the myocardium, can be infarcted or scarred or dead. You can't revive that. So putting a stent becomes a kind of unnecessary evil. And what we do is that, but if the patient comes to the cath lab within 2 hours, within 3 hours, he's given an antithrombotic treatment, and then he goes to the cath lab, you put a stent, open up the clogged artery, then his life is saved. So in the first case, you put after 8 hours, what happens is that the prognosis is not right. It is not a clinically good outcome for the patient. Whereas in the second case, wherein you bring the patient within 3 hours, his clogged artery is opened up. The prognosis and the patient's safety is much, predictive and positive. So that's what we are doing. And these are few machines, like we have our own machine. This is a Tricog's own ECG machine where you can use a mobile, very hardy. It doesn't use a power port or anything. Nowadays, like after the COVID, we had this go-to health, healthcare coming. A patient, an old patient who's there at a home, a phlebotomist may come, he may collect the blood. He can also use this because it's very portable. Like you can walk into a stall, we can show it, you can throw it down also, it doesn't break. Okay, and neither the component, gives way. So this is one thing which is, like a unique one, and it works on the mobile. It doesn't have a power source from outside, it works on the power of the mobile. Even if you have a 20% charge, you can do about 50 ECGs. So that is how it is. And the second one that we have is a conventional G machine. We have partnered with G. We give this machine in lease rental. And this is, like we give a communicator, a small gadget you can see that is on the top with the Tricog, symbol that converts the ECG signals into digital data, uploads it to the cloud, and then our doctors and the AI engine does the rest of it. Now actually also you may say that I already have an ECG machine, how are you going to solve my problem? Or we have some communicators which is compatible with most of the machine where you have a digitization code. The ECG signals can be converted into digital data and uploaded. So we have communicators. This we give it as an offering, and then we can convert. Our solution is the ECG interpretation wherein we are experts in. So this communicator can be used in case you already have a machine, and we'll see the compatibility, we'll provide this to you, and then you can do the needful. So these are the products and segments we have, and medical centers, diagnostic labs is most of our low-hanging fruits, and some of which are with us. We have tie-up with Newburgh Diagnostics, Metropolis, to name a few. Also across the country, we have so many tie-ups and all that. And cath lab centers, of course, they form the crux or the core of our business. This is the ECG report that you get. And you can see that it says Tricog verified. It's abnormal, of course. It's abnormal because there is a left ventricular hypertrophy, which is enlargement of the myocardium. And then also, there is, abnormality. And at last you see, ECG is just, a screening tool. It's not the complete thing that you get, because you are seeing the cardiac conduction system. Electricity is a vector quantity. Okay, you have minute millivolts of electricity traveling in your heart muscles, which triggers the activity or the heartbeat in your heart. So that is what we are tracing. And electricity is a vector quantity which has a magnitude as well as a direction. And ECG captures that and tells you whether it's pathological or it is normal. So this is how it is. And the abnormal activity you can see, hypertrophy, it clearly says, and at last it says, please verify clinically, because after ECG, you have to take the patient immediately. Maybe you can do an echo, you can do a TMT, or then you can go to do an angiogram. That is how you save his life. So this is the instant report. It's not only web access we have an app base also. So app base, you can see it in your mobile as well. So this is the customer, installation base that we have. We are, we almost have done about present in more than 15 countries. We have about more than 5,000 installations. And then, we have detected ECGs, diagnosed ECGs to a tune of more than 9.5, I can say very clearly. And then, we have saved lives of more than 4 lakh patients, which really gives us pride, because we started this as an idea in the mind, and right now we are where we have saved 4 lakh patients, which really, gives pride to our cause, and also, it really, encourages us to go forward. And these are something that, so what else do we offer to the centers or diagnostic centers or hospitals? We actually enable the hospital. Let us say there is a hospital, it has about 5-6 branches, and we tell them that we have a dashboard which tells them that how is the ECG happening, each and everything. It is very transparent. By the end of the day or by the end of the week, they can clearly see which center did what ECG. Just this makes, and how many patients were detected with, critical ECG, and what was the thing done. So this, makes it more transparent, and also for a huge corporate hospital, this, gives you a lot. And the most important, patient friendliness that we have an app called CardioNet. What it does is, in case a patient is detected with a, MI or a heart attack, immediately, within 10 minutes, we announce we communicate to the doctor who took the ECG, stating that this patient is having an MI condition, which is critical, please send him to a cath lab. And then what happens, immediately we also call the cath lab doctor or the hub doctor and tell him that, sir, there is a patient with a critical ECG, kindly, address and save his life. And then we call, the 3 calls goes, one to the center from where the ECG has come, second to the intervention cardiologist, third to the marketing department head of the hospital, where, he's able to send, ambulance and get the patient. And through this CardioNet app, you can see where the patient is. You can communicate to him, and also the intervention cardiologist can chat with the patient, so that if somebody tells me that I am having a heart attack with a ST elevation, I will lose half of my life that time itself. I'll start saying my prayers. To be on the funnier side, but then what happens is that if I talk to a clinician who solves this, and he handles about 10-15 patients in a day, says that I'm solving this problem for these many patients, I will be rest assured and also comfortable, okay, fine, I'm going to a safer hands. So that's what we're trying to do. And we also have something called a CDT, which is for in case a big hospital doesn't want a cardiologist or the physician from our side to intervene. You can have this wherein, after the AI, it goes directly to their doctors, their cardiologists. For example, Apollo hospitals, they follow this because they don't want their patient data to come to our doctors. They have CDT wherein, their own cardiologists, they have enough cardiologists who can read and interpret ECG. They use this solution. Thank you.